In the United States, women of color face disproportionately high maternal mortality rates, and pregnant people of color and LGBTQ pregnant people face high rates of discrimination and denial of quality health care. Black women alone are 3 to 4 times more likely to die from pregnancy-related causes than non-Hispanic white women, and twice as likely to lose an infant before their first birthday. But why is that? While there is no one factor, experts say racism, discrimination, bias, and exclusion are driving forces.
I think that we are really hobbled by systems and institutions that have racist policies, procedures, and yet we are not really willing to dismantle.
Living in America as a Black woman does something to your body. It can be everything from I feel that I'm treated differently to I am being discriminated by the police in housing and in my workplace. Those have a physical effect on the body.
According to the CDC, 60% of pregnancy-related deaths are preventable, and multiple studies have linked improved health outcomes to the support of community-based midwives and doulas.
When people are seen and they know that this person really cares about their well-being and they're hearing them, the same way my midwife and my doula made me feel, I want other people to feel the same way.
We know that community building makes a huge difference. We know that when people are struggling in their postpartum, they need community support.
During the process of birth, which is such a vulnerable time for people, getting vulnerable with a person relatively quickly during this experience, I think that can be having someone from your own community can be extremely beneficial.
Birthing people need accessible, affordable options to a range of pregnancy-related care that integrate community-based doulas and midwives.
Birth is normal. It's not a medical event. It's a life event. Unique families need to be supported by extended family that need to be supported by community.
My vision would be that we would never be counting and adding up these horrendous statistics and throwing our hands up and saying we don't know. That we would always be able to say that if there's nothing else, we cherish our own and each other's humanity.
Responses to the maternal health crisis must center the communities most impacted. Share this video if you agree.